Ending all forms of violence against the person is a global commitment of states under the 2030 Agenda for Sustainable Development. Many different forms of violence and its effects on the right to health range from interpersonal, societal, and structural violence, which are often rooted in intersectional forms of discrimination. Due to the indivisibility and interdependence of civil, political, and economic, social, and cultural rights, when one human right violation occurs, it can enable violations of other human rights. Under international human rights law, the right to health extends to effective protection from all forms of violence, torture, and discrimination against all persons and from all gender-based expressions of violence. It also requires preventative, promotional, and remedial action to shield all individuals from the harmful practices and norms and gender-based violence that deny them the enjoyment of their full sexual and reproductive health rights. As a practicing clinician with previous and ongoing experience at all levels of health systems, I have first-hand experience on the medical, social, medico-legal, and mental health needs of survivors and victims of violence, and agree with the analysis of my predecessors in that violence needs to be addressed in a comprehensive and proactive way, not only as a cause of serious violations of human rights, but also as a consequence of a lack of political will to effectively invest in human rights, including the right to health as a priority. I welcome the growing attention to human rights in situations of structural violence. A strictly interpersonal or individual conception of violence falls short in its exclusive focus on being killed, which is direct violence, and not being allowed to die, which is structural violence. Now, structural violence is a subtle and quite often an invisible form of violence which is normalized through laws, policies, and the institutionalization of certain practices that have their roots in legacies of colonialism and racism. The criticality of adopting a non-binary approach to gender and gender-based violence under the right to health must expand the scope of the definition of gender-based violence to include violence based on sexuality, sexual orientation, gender identity, and sex characteristics, thereby including all cisgender, queer, intersex, and transgender women and feminine-presenting people. The current binary conceptualization of gender as strictly being heteronormative creates an assumption that shapes how LGBTIAQ+ persons navigate social, political, economic, legal structures, including those directly relating to gender-based violence, and is one of the root causes of the particularly brutal forms of gender-based violence, hate crimes, and hate speech that they face. These are targeted and rooted in the desire to punish people whose identity, expressions, and bodies do not conform to the heteronormative man-woman binary system. And this type of violence manifests in acts that are often committed or condoned by state actors. I underscore that violations of women's sexual and reproductive health rights, such as forced sterilization, forced pregnancy, criminalization of abortion, denial or delay of safe abortion access and post-abortion care, forced continuation of pregnancy, are forms of gender-based violence that may amount to torture or cruel, inhumane, or degrading treatment. The legacy of discriminatory spatial planning, displacement, and land dispossession persist today. And this, too, is a form of structural violence, yet it is positioned as circumstantial. I'm also concerned that attacks on medical facilities and healthcare workers and personnel in all contexts, and especially during conflict and war. It is crucial that healthcare workers' physical and mental health remain supported and protected in order for them to provide quality care. In eradicating violence and promoting substantive equality, a non-binary approach to gender and gender-based violence is crucial and must be urgently adopted to move towards substantive equality and restore the dignity of all people. In the context of prevailing violence, there can be no attainment of dignity. And in order for the right of everyone to the highest attainable standard of physical and mental health to be realized, states must move expeditiously to end all forms of interpersonal and structural violence.